The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle, live in studio, waiting to take your calls on this absolutely gorgeous Washington day. 888-630-9625. That's 888-630-9625. Love to talk to you on anything you have in mind, as long as it has to do with your health, and see if we can put it in the direction that it needs to be, because you probably had a problem and you've tried, you've applied, you've done other things, but come up with, things that don't work well. Let's see if we can figure out things that do work. Have a program for you today. We have in studio someone that's going to help me walk through part of the triad of health as we talk about that equilateral triangle, that structural, chemical, emotional platform, and we're going to kind of dissect it as it relates to many other things. What are we talking about? We're talking about the emotional piece, and who better to discuss it with me than Dr. Stephanie Pina. Hi, Steph.
Hello.
Listen, this is, the emotional side of healing is an amazing piece because everybody gives it lip service, but no one really wants to stand up and take accountability for its existence, really, particularly when it comes to ourselves. And, you and I see patients daily that we know that there's a triggering mechanism behind the physical aspect or the biochemical aspect, or we know that that triggering emotional piece is one that comes about from other things that can place. They can go back and forth. There's physical patterns that can bring about emotional stuff, and there's emotional stuff that can bring physical patterns. And when we treat patients, we see suddenly sometimes emotional upsurges, if you will, things that have been packed away and put in a real safe closet and not looked at, and then when you ask the patient, about these things, some of them go back a long time. But, I'm getting ahead of some of the questions I want to ask you. Let's get into this piece about, the emotional piece with anxiety and depression and, anger patterns and, even grief that goes embedded deeply. How often do you see, in both sides, do you see this physical piece causing a physiological problem, or the physiological problem causing an emotional problem?
Well, it would be nice to say that equilateral triangle was equilateral, but I don't think that's possible when it comes in, when most people are coming in to seek our help. I think the structural, especially in our practice, the structural tends to make up quite a bit of it, and the biochemical makes up a kind of it. And then you do have people that come in that says, I have troubles with anxiety, I have troubles with dealing with grief, I have troubles with this. But most of the time, people are coming in with that physical issue because that's what they know. That's when they go to the doctor. That's when they go to seek help, because there's been also so much stigmatism around having mental, emotional issues that why would I want to put myself out there again, too? Why would I want to do this when all I've heard about how great they are with the structural and biochemical part, but I don't know about this emotional part. Do I want to put myself out there? Or I think I've already got it covered, but I'm not dealing with it properly. So what we usually see is that emotional side can be embedded pretty deep, but then sometimes when a patient comes to get to know us, or we can kind of see that there's something there, there's ways of kind of observing and asking questions to bring stuff to the surface so that the patient feels comfortable also addressing it too. Or some of the treatments that we're already doing are keeping the emotional side in place and treating it without the patient knowing, and then all of a sudden they feel much more comfortable with bringing that side of the triangle forward.
Well, let me open the door just a little bit on this, because you and I deal with this as we do across the board in our practices. In applied kinesiology, which is especially that we deal with, every muscle in the body has an organ system that it communicates with, and it's done through many different pathways, the nervous system being one of the primary. And what we know from Asian medicine, if you will, in fields like neuroemotional technique and emotional freedom technique, that each one of these organ systems has an emotion that can be attached to it, and so subsequently the muscle or the structure or the organ system is in play here. So an example. Somebody comes in with shoulder pain. And we know that the shoulder muscles, the deltoid muscles, particularly the one in the middle called the medial deltoid, the one in the front called the anterior deltoid, are related to the lung. And the lung has to do with the emotion of grief or unresolved grief. So we treat the shoulder. Patient comes in, they got shoulder pain. And they say that I got shoulder and arm and hand and my fingers hurt, my neck hurts and so forth. And we start treating them. And then all of a sudden, for no reason, up pops this grief pattern. There's something, I feel sad. What did you do to me the other day? What's that all about?
That's part of the healing process. That's why the emotional side is on that side of the triangle. That's why it's there. People saw it. They observed it. What's amazing is sometimes we try to create that physical part of the emotion so that it's got a way to express itself. I mean, we think about it like we're always taught from when we're a little kid to have personal hygiene, right? You're going to brush, when you go to bed, you brush your teeth, you change your clothes, you wash your face. But what about emotional hygiene? We don't know how to deal with that. We don't know. We learn how to make coping mechanisms out of it. But what we try to do with it can also become a physical issue pretty quickly as well, too. So in this case where shoulder pain comes in, all of a sudden, in order to truly treat that person to their fullest extent of healing, you need to address the emotional side. So a lot of times patients in those examples will go, oh, I didn't want to deal with this. Like, this is why I'm here. I came to you for my shoulder. But when you try to address that part of it, they realize, and you put the two of them together and explain it to them, they start to realize that really they're not fully healed until they address that emotional side. And they have to be comfortable with that. Because a lot of times they're like, yeah, thanks for this new issue. I didn't want to have to deal with this anymore. And that's why it's still lingering for sometimes a short period of time, sometimes a long period.
This Wednesday evening, Dr. Stephanie Pina will be presenting a really interesting lecture, and, the title is Unpack Your Emotional Baggage. And she's going to do that at 7 p.m. at the Fairfax office. We're just off of the National Capital Beltway on Route 50. So while the sun is still light outside, you ought to join us 7 p.m. And all you need to do is go to RoselleCare.com. That's RoselleCare.com. And as a special gift to those of you who are out in Ashburn, way out in the Tules, a little west of us here, Dr. Leonard Poe is going to do this lecture for us on Thursday at 6 p.m. And if you'd like to register out in Ashburn, all you need to do is go to core2concepts.com. That's core2concepts.com, and you can register right online. So RoselleCare.com, but if you want to go to the Ashburn, you have to specifically go to that website and go to core2concepts.com. That's Thursday night at 6 p.m. and Wednesday night at 7 p.m. at the Roselle Center for Healing in Fairfax. Trust me, this is a lecture that you really want to attend. If you have any suspicion that you're dealing with stuff, you put it away, and maybe that your body's not expressing itself as optimally as it should, this is an opportunity that you really need to pay attention to. Because if you're on the medications like Prozac and Zoloft and Paxil and Lexapro and Celexa and so forth, and all those silly things that your well-meaning doctors like to put you on to kind of cope with, deal with, put up with, wouldn't it be great if you could, kind of circumvent the side effects and get off of this stuff and actually deal with stuff, and maybe just by releasing that attachment, now you start healing. And sometimes, when things come up, we all think that we have to analyze and we have to, sit in therapy for years and years and years. But what if there was a better way? What if there was a faster way of dealing with the stuff? What if you could just let it go, release it, and you start healing? What a wonderful concept. Give us a call, 888-630-9625. Dr. Pina, let's talk about that a little bit. And here's a question, and I just brought it up in my comment. By fixing the physical aspects, and if you go after the emotional with it, does the patient have to go into all of this, problematic revealing of the soul and dealing with things, or can they just release the stuff and they start healing?
They can just release it, because one of the things that's interesting is everybody does that very differently. Some people, it might be another physical symptom. It's another way that they're kind of bounding and guarding what they're kind of protecting themselves. They have control over it at that point. So one of the things that I like to see is that when people come in, especially because they will blame stress all the time. Stressors are doing this to me. I have all this stuff to do, and this is why I have anxiety, and I can't get it done, so it adds more to it. Well, those stressors probably aren't going to go away. And we talked numerously over how the adrenals deal with it, how the sympathetic system, our fight-flight system has to deal with it. And when it goes into overdrive, now it's creating all those health issues that we know are worse with long-term stress. But when we deal with the emotions, we can peel it back one layer at a time, like the old onion analogy. And some people don't feel like they have to go through this big unveiling. And some people don't do well with that. You talk to people all the time that say, you know, I went to a support group and this didn't work for me. Or I was listening to this motivational speaker that's supposed to be great and everybody loves him or her and it just doesn't do it for me. Everybody responds a little bit differently. So they have to be able to embrace what's going on with their own emotions and kind of go, this is creating an issue. What do I want to do and face it head on? That doesn't have to be overnight. That doesn't have to be tomorrow, but it definitely needs to be part of the healing process.
You know, one of the interesting things that I see on a regular basis is the internalization of stress to the point where people destroy their teeth in their mouth. Because what they do is they're always in a state of clench. And it's, you know, that clench sometimes is the aggressive piece that they don't want to let out. They don't want to explode. They have that anger that's built up and so forth, and they're trying to control it. And in Asian medicine, there's a reason for that. But at the end of the day is that they have these ongoing pain patterns that can have to do with the head, neck, and shoulder mechanism. And then what we see is that when you treat them appropriately, when you allow that energetic to balance, when you bring those things out, suddenly that headache goes away. But the problem is, and here's a question I have for you, is that when you release this stuff, is it gone, or now do you have a void that has to be balanced and filled with something else?
Good question.
Indeed.
Guess that's why you asked it, right?
And that's why I asked it.
I think it kind of varies, you know, and every person's a little bit different. But I think what it does do is when it does get released, and especially if a patient can notice it and they can learn to observe their own body signals, they really start to embrace the fact that this was causing an issue in the long term. It was this psychological, emotional thing was causing a physical issue. Why am I going back to that? So just like emotions are signs to us that something's not going awry, pain is the same thing too. It's another, you can almost think of it as another type of emotion. It's a signal that the body is trying to put out there that says something's not right, we need to connect it. So whether or not it's completely gone or it leads to something else, it's all a deep part of who we are and our experiences as well too. Because if we have a good experience with a good treatment, then we're going, okay, let me take it that next step further. If we have a bad experience, like numerous people come in all the time and say, you know, I had that bad experience with a blood draw as a kid. I don't know about this whole acupuncture thing. That's already putting an experience in there that we have to release too and say, this is not just a method to get things out. It's part of what that experience was and how your mind is perceiving stuff that's going on. And that has to deal with whether it's an acute issue like wound care and slowing down wound care, or it can be a chronic issue like getting a diagnosis that is not favorable, or dealing with chronic illness, which we see a lot of, and even more so now, I think.
You become your history sometimes, and similar situations trigger the same response over and over again. You and I were talking about that earlier on the way to the program today. Having said that, this Wednesday evening, coming up, the 22nd of August, Dr. Stephanie Pina, 7 p.m. at the Roselle Center for Healing in Fairfax, just off the National Capital Beltway, will be presenting a very amazing program on Unpack Your Emotional Baggage, and we will do it again for you on Thursday at 6 p.m. For those of you out in the Ashburn-Leesburg area, go to core2concepts.com, core2concepts.com. Dr. Leonard Poe will be your guest. We'll be right back. Welcome back, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle Live. I'm in studio. 888-630-9625. That's 888-630-9625. Love to talk to you on anything you've got in mind. My guest in studio, Dr. Stephanie Pina. We're talking about her presentation this Wednesday evening, 7 p.m. at the Roselle Center for Healing. That's the 22nd of August, and she's going to be talking about unpacking your emotional baggage, and we'll be getting into that very specifically. And for those of you out in the Ashburn area, we're going to repeat that lecture on Thursday at 6 p.m. at Core 2 Concepts. And all you need to do is go to core2concepts.com, register if you're out in the Ashburn-Leesburg area. Dr. Leonard Poe will be your presenter out there. But before we go further on in the program, Charlene, you've been extremely patient. How can I help you?
Hi, Dr. Roselle. Thanks for taking my call. I have spinal stenosis, and it's very painful. I take Tylenol, but it helps me for an hour, and then I have to get out of bed and sit in my rocker, for another session until 4 hours pass, and I take another Tylenol. What I want to know is acupuncture or chiropractic helpful for a condition like this? It's my SI joint that really is the worst.
Extremely effective. And here, let me give you a little heads up on the Tylenol. Unfortunately, you want to be very, very careful with Tylenol because Tylenol, chronic use of it is the number one reason for liver failure in hospital admissions to the emergency room for that condition.
I'm aware of that, so I take it every 4 hours. I just take 1/500 every 4 hours.
That's a lot of Tylenol, my friend. That is a ton of it. And that's not doing it a little bit. That's taking a lot of it. Oh. And unfortunately, it's going to have an effect. But here's the problem with it as well. Because of that, it's a self-perpetuating problem. It'll make things worse for you because it causes the liver not to work properly. And if the liver's not working, inflammatory levels get higher. So you're putting out a self-perpetuating situation. So having said that, when you deal with stenosis, and for our audience, I'm just going to kind of brief everybody on it. Stenosis is a narrowing of the canal where the nerve comes out of the spine, and it can be because of the disc height is not adequate, so the two bones come together and they close the hole a little bit. It can be because of scar tissue that gets into it. It can be because of calcium that gets into the hole. Regardless of the cause, it's the nerve is being compressed. Subsequently, you're not only going to get pain patterns, but you're going to get loss of function. But the more that can be builds on itself, the worse it becomes, the more destructive it becomes over a period of time. So to answer your question, how that works, yes, if you chiropractic care, but what we call long axis decompression of the spine, but acupuncture, low energy light laser, dietary changes and so forth can be a huge, huge benefit to patients who have spinal stenosis. Dr. Stephanie sees these patients all the time. Dr. Steph, in your experience with spinal stenosis, why don't you jump in on this?
Yeah, we see it in combination all the time. In fact, there are patients right now that when they've done one or the other, it's not been as beneficial as when you put them together. So a lot of times you're just helping to not only relieve pain, but to help with the structural aspect of it. And a lot of times when we're talking about emotions in this show, there's a lot of emotion tied up with it because you haven't been able to function properly. And you're going, what's next? What's next? And so when we treat this, we need to open up that whole area physiologically, structural, and also see if there's a mental emotional aspect to it.
Charlene, and the other thing that you have to be aware of, and anybody who has any kind of spinal degenerative processes, and that's what stenosis is that anything that causes inflammatory response, and when I use the word inflammation, I want you to think of acid. So things like sugars and soda and coffee and black teas and fast food, fried foods, alcohol, gluten, additives, preservatives, GMO products, any of those things will increase inflammation in the body and cause the problem to be worse. You want to go very alkaline in your diet, and what alkaline means is tons of green. Anything that is green is alkalizing to the system. Red meats are very acidic. An avocado is very alkalizing. Sugar is very acidic. So you want to look at it that way. Green tea is very alkalizing, but you want to make sure that it's organic. You want to make sure that you're drinking a ton of water in the body. There are enzymes that will make things much better, but you have to combine them, as Dr. Stephanie just said. You have to look at it multidimensionally. Yes, acupuncture will work. Low energy laser will work. Chiropractic care very specifically in combination will these things work, but you got to change a lot of things. So the bottom line is we can help you, and if you have the opportunity, give us a call and be more than happy to walk you through it. 888-630-9625. That's where we are right now. And this Wednesday evening at the Roselle Center for Healing in Fairfax, Dr. Stephanie Pina will be your host, your presenter, and she's going to be talking about a very interesting subject about unpacking your emotional baggage, getting rid of all the emotional stuff that's associated often with the pain that you're in, the dysfunction that you're in, the inability that you have that we keep kind of nursing and taking care of and stroking and so forth. Wouldn't it be great to get off some of these drugs, the Paxos, Alexas, Lexapro, and so forth? It would be a great opportunity. And then for those of you out in the Leesburg, Ashburn area, on Thursday at 6 p.m., Dr. Leonard Poe will repeat the presentation, and all you need to do is go to core2concepts.com and register. We'll be right back. Don't go away.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle Live. I'm in studio. Give me a call, 888-630-9625. That's 888-630-9625. My guest in studio, Dr. Stephanie Pina. She will be your host, your presenter this Wednesday evening, 7 p.m. at the Roselle Center for Healing in Fairfax. We are just off the National Capital Beltway and literally just off of it on Route 50, and maybe a third of a mile, half a mile on your right-hand side. You turn right, and we're very close, so you can find us without too much hassle. But for those of you who are out in the Ashburn area and the Leesburg area, we're going to repeat this program on Thursday at 6 p.m., and Dr. Leonard Poe is going to do it. And to register for that class, and I think I may have made a mistake when I gave you the website, so here it is. It's core, the number 2, Chiro, CHIRO.com. Core, the number 2, Chiro.com. And all you got to do is go to the website. It's there, and register, give them a call, tell them that you're coming, and you will have an opportunity to talk to Dr. Poe about neuroemotional technique and the program that Dr. Pina will do at the Fairfax Center on Wednesday evening. Dr. Pina, this is an important topic. It really is, because there's so many of us that have emotional triggering patterns. And, it's like we go back and, I was having some fun looking at the website, our website, rosellecare.com, and, you got these bags, these suitcases stacked up, and everything from the top one, I think, said grudges. And, we hold on to stuff forever. We just kind of gnaw on it, don't let it go. Sometimes, we don't have the successes in our life that we want because of fear patterns. We don't have the successes in life because we're afraid we're going to lose something, or we're afraid that, whatever. You can put the pieces on it. But this is what we're talking about. And then they embed into physical patterns. And then that physical and the emotional seem to be self-perpetuating. Can you give us an example?
Well, it's funny that you brought up the kind of the Chinese medicine aspects or the Asian aspects of how there's an organ system and there's an emotion with it. And the best way that I used to explain this is a lot of people will come in, and when they feel upset to their stomach or they're getting nervous about something, they might get an upset stomach or have to run to the bathroom, and it just can't hold anything down. And what's interesting is the spleen or stomach and digestive tract in Chinese medicine, the emotion that goes with it is worry. But really, when you look at more of the research around here, the word we think of it in modern day terms is not just worry, it's rumination. Is the fact that we're ruminating on our food, just like we're breaking down our foods. We're ruminating on these thoughts of what if and what's going to happen, and oh my goodness, what's the worst possible thing? And that's allowing this physical reaction to happen. And what's funny is we could have a stomach ache, or we could have upset stomach for a couple of different reasons. It could be because of the stressor event, or it could be because we ate something bad. But we start to build on this. And so the next time we have an upset stomach, oh my goodness, is it a bacterial infection? Am I worried again? What's going on? So our body and our brain start to trigger and remember these responses. And so it becomes built into our system so that next time even any kind of trigger comes along, it can lead to a physical reaction. We see that happen over and over again with different physical responses. And so in order to break that cycle, we have to change how the brain really experiences it. Does it have to have that biological reaction where our stomach starts to hurt? Do we have to ruminate over it, or can we leave it and let it go? So when we play with the unpacking your emotional baggage, that the clothes and the baggage had to get there someplace, sometime at one point. When do we want to unpack it all together at once, or do we want to unpack it bit by bit when we get back from our trip and our vacation?
888-630-9625. That's 888-630-9625. My guest in studio, your host this Wednesday at the Roselle Center for Healing in Fairfax, Dr. Stephanie Pina. Interesting topic. And then we're going to repeat the program on Thursday at 6 p.m. For those of you who are out in the Ashburn, Leesburg area, Dr. Leonard Poe will be your host out there, and he will be talking about. So to register for the Western Suburb program, all you have to do is go to CORE, C-O-R-E, the number 2, Chiro, CHIRO.com, core2chiro.com, and register for that class. Again, in each setting, space is limited, as those of you who've been to our programs before know that you got to register so we can confirm with you. Having said that, let's go to the phones just for a second. Shirley, thank you for holding. How can I help you?
Yes, good afternoon, Dr. Roselle and Dr. Stephanie. Yes, I have a problem with my cholesterol. The total is back in when I had my annual 232, LDL 147, HDL 67, and she is really concerned about the cholesterol and wanting me to take this pravastatin sodium 40 milligram, and I'm just nervous about any medication.
Well, you should be. So let me ask you a couple quick questions, Shirley. First of all, how old are you?
74.
Okay, so here's the truth about cholesterol. The numbers that you are physicians are touting these days are numbers that the drug companies have put out there. So you're getting total cholesterol, you're getting HDL, you're getting LDL, you're getting the ratios between the two of them, you're getting triglycerides, and that's about it. There's a test called the VAP test, VAP, and it breaks down all the subfractions of cholesterol. So back in the day, when I was first in school, total cholesterol normal was 235. The LDL normal was 130 to 135. The HDLs, we want them always above. For a man, we want them in the neighborhood of about 45 or above. A woman, we want it at 50 or above. And, the higher the better when it comes to those things. And triglycerides, the laboratory ranges are 149 or less. I like to see them actually under 100. But where you are right now, you're not in a dangerous situation. You need to find out what the subfractions are of those things. And now even further on, the HDLs, which are purported to be your good guys, okay, those are the ones that protect you and put the fire out and stop things from plaquing and clotting. You have really good guys, the ones that are very protective, and you got guys that are not so good. And it doesn't mean that they hurt you, it just means they're not protecting you the way they're supposed to. And then same thing for LDLs, the low-density lipotrophins. That's what they stand for. The HDLs, by the way, is high-density lipotrophins. So there's subfractions into things called apolipoproteins A, apolipoproteins B, but they go even further than that. But in the bad guys, you've got guys that are really bad. I'll give you kind of a metaphor. If you have a lot of BBs and they're heavy and they're magnetic, they stick to the bottom. They clump together. Those are the really bad guys. And then the guys that are not so bad but are LDLs as well are like very fluffy, bouncy beach balls. They kind of bounce around. They get in the way, but they don't stick to anything. So that's now obviously it gets more significant than that, but that's basically what it is. So I would not, first of all, as you get older, you want your cholesterol to be a little higher because otherwise your brain's not going to work. Whatever hormones are there are not going to fire properly. Body's not going to be able to heal. You're going to increase your risk of dementia and certain types of cancers.
So I'm not in any real danger?
Well, honey, I don't know. Okay, so I don't know all the subfractions, but based on what you're telling me, I wouldn't be so concerned until I had other things done. Now, most of your physicians will not run those other tests. They said they're too expensive, your insurance doesn't cover it, and so forth.
Yeah,
but there are cash.
My insurance don't cover the VAP test. I've asked about that.
Sure, but there are cash laboratories that you can have done. Principal Labs is one of them, and if you don't mind writing the check for a couple $100, you can get a ton of laboratory work done that normally would cost you over $2,000, and you can get those subfractions taken care of. We do it all the time.
Okay.
And so understand that. So what I'm saying to you is that I'm not telling you that you don't have a problem. I'm not telling you that you do have a problem. I'm saying that the story's not in. And for me personally, or if you were my wife, I wouldn't be running off to take a statin until I had all the other data. And even at then, here's the real story with statins. They did a study, and guys are at worse risk than women. But if you go into your websites and you look up statins and aspirin and so forth, you're going to find that they don't really work. They increase the risk of a lot of stuff. They did a study that was published in the New England Journal of Medicine about 4 or 5 years ago, and where they studied a ton of guys. What they concluded was you have to treat 100 men with a statin for 5 years to prevent one heart attack. That was the conclusion in a medical journal. So the drug companies have huge money out there in these drugs, so they want you to take it. For example, the FDA completely reversed their opinion on aspirin in 2014 in August, it came out, and 100%, 180-degree reversal. And what they said is that people on aspirin therapy have the worst cardiovascular outcome, including increase of risk of stroke and heart attack, than somebody who's not on them. And why? Because it causes them to bleed. But they immediately came out and said, well, you need to take it anyway, just in case, and oh, by the way, it's good for these types of cancers. Why would they do that? One company, Bayer, Bayer aspirin, right? Just from the one product, you know what their bottom line is with that one product per year? It's $1.27 billion per year. So they have, it's like the fox in the hen house, right?
Yeah.
So anyway, if we can be of help, give the office a call. More than happy to, to guide you, to send you to people that, really know their stuff. I appreciate it, Shirley. Thank you very much for your phone call. Typical, right?
Yes.
Very typical.
And there'll be a quiz on this on Wednesday and Thursday. No stress and anxiety, right?
That's right. No stress, no anxiety. Matter of fact, I'll give you the cheat sheet. not an issue. We're here at 888-630-9625. Your host this Wednesday evening, my guest today, Dr. Stephanie Pina. She's going to be talking about unpacking your emotional baggage, all that junk that you can't get rid of, that, you went to your doctor and it gives you this, it gives you that. And, now the biggest thing out there is everybody wants to go on CBD oil. They want to go on marijuana oil for their anxiety levels, right? So how does that all work in? Or does it make it even worse?
I don't think it makes it worse.
We're talking about the oil, Dr. Stephanie, not the real McCoy.
Well, and that in itself is very interesting because there are a lot of studies on CBD oil, and it is very different from the medical marijuana uses and stuff too. But, it's like any substance when someone wants to replace something, when we're thinking non-pharmaceutical based, right? Even if we look at other supplements and other things, what's interesting is I look at Chinese herbal formulas, and they were never given one herb at a time. Whether they were treating pain or, an emotional issue or a digestive issue, they were given together in pairs because they balanced off of each other. Well, for the emotional issues, what's interesting is a lot of them were grounding agents, things that kind of brought us back down to earth, like minerals. They used to call, there's one herb that's dragon bone and oyster shell. Well, if you think about it, what are they? They're calcium and magnesium sources.
Relaxation.
The relaxation stuff. So this concept, change the item out per se is not away from us. It's not something totally uncommon, but that idea that the body needs that chance to relax, and there's nothing wrong with relaxation. I have plenty of patients that come in for acupuncture, or the ones that come in out of massage, and they can barely, they're like, where am I? I'm so relaxed. Like, do I have to go back to work? Do I have to get back on the beltway? That is a healing process in itself. It's just finding the right thing for that individual person and making sure that they're not overusing things. Now, I'll recommend the overuse of acupuncture all day long, and massage too, because we have a great massage therapist.
Yeah, we do. She's amazing. But
one of the main things too is you have to find that thing that helps that person relax. And if they've been running around or been taking care of the kids, or, we talk to the teachers now that are getting ready to go back into school, so they're stressed because they're trying to get their classrooms going, and their whole structure of their day is going to be off because they used to be able to eat whenever they want, and now they have 20 minutes maybe. All of that's throwing more stress in there. So if relaxation gives you that 25 minutes to kind of calm down and not have to think about something, that's a therapeutic value right there. So.
It's interesting. One of our patients last week, who is I'll use the word cranked up, came in, and it was the first time I had the opportunity of treating this patient. And she was very, very, very upset about something that was going on, and all I did with her on that visit is I normally, would do certain things because she had neck and shoulder and arm pain, and I treated her and I did some reflex patterns and so forth. But what I ended with was treating her first cervical vertebrae. That was the last thing I did, and I opened that area so the nerve wasn't irritated, and the vagus nerve, our big wanderer that comes all the way through and touches so many areas, and when I saw her in the office a few days later, she told me, she said, I slept. I said, oh, well, great. She says, no, you don't understand. She says, I don't sleep, and I woke up and my anxiety wasn't at the level that it normally. She says, what did you do? Well, when you treat the upper portion of the neck, it has what's called a parasympathetic response in the body, which is a relaxation effect. So going back to what we were talking about, treating things multidimensionally, when you treat the acupuncture system, either with laser, with needles, or with finger pressure, with herbs and so forth, and you affect that. When you're dealing with myofascial release and so forth and getting rid of the buildup anxiety, or you're looking at the upper portion of the spine, which triggers the release of things like serotonin and dopamine and balances them out. Now the patient goes into this relaxation, almost euphoric situation because it's different. It's separated from, what they were experiencing before. This Wednesday evening at the Roselle Center for Healing in Fairfax, my guest today, Dr. Stephanie Pina, will be your host, your presenter at the Roselle Center for Healing. We're just off the National Capital Beltway on Route 50, literally a third of a mile, or a half a mile off. And very easy, very accessible, and we start at 7 o'clock. You know that we need reservations because once we're packed, we're packed. And then for those of you out in the Ashburn-Leesburg area, Dr. Leonard Poe will do the program on Thursday at 6 p.m. To register, all you got to do is go to core, number 2, Chiro, CHIRO.com, core, C-O-R-E, the number 2, Chiro.com. And register online. And again, please give us a way to get a hold of you so we confirm. These are two opportunities that you have. One on Wednesday night at 7 p.m. In our Fairfax office, and another one in our Leesburg office. And you can get this done. This is an opportunity to get information, get a handle on the things that you need to do to make a difference, to get off of the Xanax, get off the Lexapro, get off the Prozac, get off of this, all the things that your doctor said you got to stay on for the rest of your life. It's not okay. And by the way, do you know that a lot of the medications that you're on have these very specific side effects? All the things that we're talking about. But how about getting rid of all of the garbage, the things that you've been holding on to, the things that have been your puppet for a while? Don't go away. We'll be right back.
105.9 FM and AM 630 WMAL.
Welcome back, everybody. Dr. Tom Roselle here. You've been listening to Dr. Tom Roselle live in studio. You can find us every week right here, same old time, same place, 12 noon, except coming up when Redskins full season starts and we run up against a game. Then we're going to be on Saturday, but we'll let you know about that as time goes on. My guest in studio, Dr. Stephanie Pina, your host this Wednesday evening at the Roselle Center for Healing in Fairfax, 7 p.m. She's going to be talking about unpacking your emotional baggage and all the stuff you can do about it. And then a repeat performance on Thursday at 6 p.m. out in Ashburn. Dr. Leonard Poe will present, and he will, basically cover the same information. But what you need to do is to register for both. Go to rosellecare.com. That's ROSELLECARE. And if you're out in the Ashburn area, you have to go to core, C-O-R, the number 2, Chiro, CHIRO.com, and register there. Let's go to the phones. Ed, thank you for holding. How can I help you?
I was wondering, can you use a brain scan to diagnose mental illness and brain damage?
Okay, so let me handle that. I wish you would have called earlier. I would have liked to spend a lot more time on it. So the answer is yes and no. You can diagnose increased brain activity with any kind of brain scan or MRI and so forth. A lot of the guys that are coming back from overseas, particularly with PTSD problems, what they're noticing is there's a tremendous amount of activity in different parts of the brain, and it goes to the lower rudimentary portion of the brain, what we call the reptilian brain area, the amygdala and so forth, which controls emotion and fear patterns and the like. So you can see increased activity. Does it tell you exactly what's going on? No, not really, because the variation in activity is different from person to person, from male to female, and sometimes even based on body structure and so forth. Somebody who is the size of my son, about 6'4", and somebody who is 5'2", are going to have different neurological aberrations that are there. But you can pick up. It can help you say that there's something going on. But does it diagnose it specifically? No, it does not. But it gives you more information that you can. In our work, we look at other energetic platforms relative to this and generally don't rely on that, because if they could figure it out from that, then it would be a whole different ballgame. Ed, I'm really sorry that I'd love to get into this further with you. You can send me a note at rosellcare.com, and I'll get back to you. Dr. Pina, coming up to that piece, what are you going to cover this Wednesday evening, and what are we going to do in Ashburn as well?
Well, emotions matter. That side of the triangle, along with the structural and biochemical stuff, needs to be addressed. And a lot of times patients are coming in not knowing that they're having an emotional issue and it's attached to their physical issue. So we need to learn how to address that. We need to know that it's completely normal and that really the best thing for that is individualized treatment to really figure out what's going on and to take that step by step. So what we're going to cover is essentially recognizing that and understanding that the body has a way of physically responding to emotions, and the emotional reactions need to be controlled as well too. A lot of the times people have questions and they want to know, have we cured this or that, or, are you diagnosing depression and anxiety? Some people are coming in with those diagnoses already made, so you might be kind of helping them kind of deal with things that they're not getting either current treatments as well. So essentially we're here for the people to ask those questions, but know that the emotional side matters and that really we need to look at it from an individual basis. And I'm sure Dr. Poe is going to cover some of the techniques that he uses that he sees very effectively, just like I see how you use basic acupuncture points and some of the supplementations and decreasing inflammation in the body to cause less of a reaction overall so that emotions can have a chance to heal just like the rest of you.
I wish our last caller had called a little earlier. I would have loved to have gotten into TMS therapy with him, transcranial stimulation, because there's the reason that works is they're breaking a cycle, but it doesn't hold. That's a whole different story. The jury's out on a lot of that type of procedures. For a short period of time, yes, there's responses, but you still have to know what the triggering pattern is. You fix that, it goes away. We're coming up to the end of the program, unfortunately, way too short as always. We'll be here next week. See you later. We love you all. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellcare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Bye.